Hello, everyone. Welcome to Intellectual and Developmental Disabilities Overview Training, otherwise known as IDD. Today, we'll be discussing definitions and recognition of disabilities, disability awareness etiquette, person-centered services, and level of supervision. Now, what is developmental disability? It's a broad term used to describe delays in one or more developmental categories. There are numerous causes of developmental delays, including early brain or birth injuries, genetic disorders, and environmental factors. Developmental disabilities can often include intellectual disabilities as well. Some examples are autism, cerebral palsy, or epilepsy. Developmental disabilities are likely to continue indefinitely. They result in a substantial functional limitation in 3 or more of the following areas of major life activities, such as self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency. Intellectual disabilities are disorders that originate before the age of 18. An intellectual disability describes someone who has a below average IQ and who lacks the skills needed for daily living. People with intellectual disabilities are capable of learning, but may require more support and adaptive teaching strategies. Some characteristics are issues in adaptive behavior that may include difficulties with conceptual skills, social skills, and practical skills. Individuals with intellectual disabilities often exhibit deficits in self-determination skills in areas such as choice making, problem solving, and goal setting. Some examples are Down syndrome or fetal alcohol syndrome. Autism overview. Autism is a developmental disability that usually appears during the first 3 years of life. The cause is still unknown, and it affects how a person's brain works. Not all people with autism are affected the same way. When a person has autism, they may have difficulty letting you know what they want, what they're thinking, understanding what others say or want, ignoring sounds, things, or people that are moving, ignoring lights, being touched, understanding social rules, showing affection, controlling their feelings, and dealing with change. Autism is a spectrum disorder. That means that not everyone with autism has all the problems. One person may have 3 of the listed problems, while another person has just 1. Just some things to remember when working with someone on the autism spectrum. Always respect personal space. And no sensory processing issues are common in individuals on the spectrum. So light, sound, touch, etc. And just be patient with communication, using sign language, visuals, or gestures to help with communicating. Cerebral palsy overview. Cerebral palsy is a group of permanent movement disorders that appear in early childhood. Signs and symptoms vary among people and over time. Often symptoms include poor coordination, stiff muscles, weak muscles, and tremors. There may be problems with sensation, vision, hearing, swallowing, and speaking. An individual who has cerebral palsy does not necessarily have an intellectual disability. Adaptive activities to increase independence for the individual. So using a tray to make paper more accessible or using adapted utensils so that they can feed themselves. A disability versus handicap. What is a disability? A disability is a physical or mental impairment on an individual that substantially restricts one or more major life activities. A handicap is a societal, environmental, or self-limitation or barrier imposed on an individual. Handicap refers to an obstacle imposed on people by some constraint in the environment. The power of words. So being mindful. Think before you speak. What we say and how we say it can enhance the dignity of those we serve. How we think affects how we talk and behave. The words we use can reflect our own stereotypes and negative attitudes and feelings. So again, just be mindful when speaking. So disability language and etiquette. It's all about respect, common sense, and common courtesy. The right language challenges discrimination and stereotypes. Some common words and phrases reinforce prejudices and assumptions. Language is continually evolving. Not everyone agrees on what is appropriate and what isn't. Sincerity and honesty goes a long way. And be supportive and open when language inadvertently offends an individual. Always know that it's the person first, then the disability. You want to speak of the person first, then the disability. So we want to emphasize abilities and not limitations. We don't want to label people as part of a disability group. So don't say disabled or say people with disabilities. We never want to patronize. And choice and independence are very important. A disability is a functional limitation that interferes with a person's ability to walk, hear, talk, or learn. And the use of the word handicap should only be used to describe a situation or barrier imposed by society, the environment, or oneself. So again, it's always person first, then the disability. So these are some examples of appropriate language versus inappropriate language. We always want to say person with a disability instead of saying disabled or handicapped person. So person with cerebral palsy or person with autism. And we never want to say things like palsied or CP. Or we can say person who has autism, person who has cerebral palsy. We never want to say afflicted or suffers from or victim. We want to say things like he or she is without speech or is nonverbal. We never want to say mute or dumb. We want to use developmental delay versus slow, emotional disorder or mental illness versus saying crazy or they're insane. And then we want to say things like this person with Down syndrome instead of saying they have Downs, and then of short stature instead of saying dwarf or midget. So guiding principles in supporting persons with developmental disabilities. We always want to strive to build and support relationships. We want to utilize natural supports as much as possible and stress community involvement. We want to support active participation, even if partial participation is necessary. We want to be sensitive to individuals' rights, particularly privacy, personal decision-making, and personal space. We always want to maintain natural routines and rhythms. And we want to be conscious of age and appropriateness, be active and respectful partnership with families, utilize the power of modeling in your own behavior and self-presentation, and work in the broad sense as an enhancer of quality in a person's life. Some tips for effective communication. So number one, speak directly rather than through a companion or the sign language interpreter who may be present. Number two, we want to offer to shake hands when introduced. People with limited hand use or artificial limbs can usually shake hands, and offering the left hand is an acceptable greeting. Number three, we always want to identify yourself and others who may be with you when meeting someone with a disability. When conversing in a group, remember to identify the person to whom you are speaking to. Number four, if you offer assistance, wait until the offer is accepted, then listen or ask for instructions. Number five, treat adults as adults. Address people with disabilities by their first names only when extending that same familiarity to all others. Never patronize people of short stature or people in wheelchairs by patting them on the head or shoulder. Number six, do not lean against or hang on someone's wheelchair or scooter. These mobility devices are for many individuals considered extensions of their bodies. Number seven, you want to listen attentively when talking with people who have a difficulty speaking and wait for them to finish. If necessary, ask short questions that require short answers or a nod of the head. Never pretend to understand. Instead, repeat what you have understood and allow the person to respond. Number eight, place yourself at eye level when speaking with someone who is of short stature or who is in a wheelchair. Number nine, tap a person who has a hearing disability on the shoulder or wave your hand to gain their attention. Make eye contact, speak clearly, and be expressive to establish if the person can read lips. If so, try to face the light source and keep hands and food away from your mouth when speaking. If a person is wearing a hearing aid, do not raise your voice. Speak slowly and clearly in a normal tone of voice. And number 11, relax. Don't be embarrassed if you happen to use common expressions such as see you later or did you hear about this? That seems to relate to a person's disability. A supervision overview. Levels of supervision. So line of sight supervision is broken into 4 levels here at SKSF: minimal, moderate, line of sight, and direct support. For minimal, the individual does not need a support person immediately to provide supervision during the day. The individual may have a minimal or periodic need for supervision due to the specifics of the job or day program. For moderate, generally, this individual needs a support person immediately available in order to perform the job function or participate in the day program activity. The individual may not have all skills necessary to perform the job or to participate in the activity. This individual must be able to access support immediately when needed, but may be out of sight of the support person for periods of time. The amount of unsupervised time may apply, and if so, an amount should be specified in the service plan. For line of sight, the individual requires direct supervision during all services, including in the home setting, at supported employment, or at day program due to significant needs in areas such as medical, physical, and behavioral. This individual has exceptional medical needs and or exceptional behavior needs that have a high degree of risk, therefore requiring that the individual be seen, meaning a staff person must have eyes on the individual by the support person at all times. For direct support, this individual meets the criteria for line of sight, but his or her needs are so critical that staff support must be within arm's reach in order to provide needed support and reduce risk. The amount of unsupervised time does not apply given that this individual needs an intensive level of support. So someone with this direct support will have 0 amount of alone time or 0 amount of unsupervised time. The following procedures are designed to ensure that individuals are being supervised with appropriate line of sight supervision in accordance with their service plan or care plan at all times. So number 1, SKSF Adult Services requires that all individuals be in the same room and or general area of a support staff and within visual line of sight at all times during the program. However, if their service plan states that they are minimal or moderate, they can be allowed out of line of sight as long as the support person knows where they are when they're returning. So if they're going to the restroom or we're going to get a drink of water, they need to know. The only individuals exempt from the line of sight policy are those who have a service plan that specifically states they are minimal or moderate. Number 2, line of sight, as defined above, requires that all individuals be assigned to a specific support person and are in that person's sight within a safe distance. The assigned support person needs to be able to get the individual quickly when there are possible safety issues or support needs. Number 3, if the assigned support person needs to leave the room for any reason, that person is required to let another support person know they are reassigning line of sight supervision. Verbal acknowledgement is required before the support person may leave the room. Once verbal acknowledgement is received, the other support person is responsible for the individual until another support person takes over line of sight supervision for the individual. Number 4, individuals who have a service plan that has specifically outlined the need for direct support line of sight supervision must be within arm's length of a support person at all times. If a support person is reassigning direct support line of sight supervision to another support person, they must notify the person of the increased level supervision prior to turning over supervision accountability. Number 5, it is a support person's responsibility to ensure that they have the necessary person-specific training or at minimum basic knowledge of the individuals they accept line of sight supervision for. Staff and supports need to know an individual's behaviors, protocols, and any special considerations needed to properly supervise the individual prior to accepting line of sight supervision. For questions, you guys can email us at sksf@sksfcolorado.org. That is all for the IDD training, and I hope you guys have a wonderful day. Thank you.